Good afternoon, everyone, and thank you so much for logging in and taking time out of your day to spend with Transit Alliance, learning more about transit. My name is Jessica Dauphin, and you can also see on your screen Alex Macias. You can't see our speaker today, but Steve Bland is with us. He's on the phone.
Good afternoon.
I can't tell you how grateful we are to be able to bring this conversation to our communities. This is just a stellar opportunity that we have, and I'm grateful to be the one to bring it to you all. We felt that it was important as we move toward a phased reopening process in Middle Tennessee. It's important for us to understand how COVID has already affected our public transit and where we might be going. So this series of speakers objective is to get us there, so we're all having a similar conversation as we move forward. Start things off today, we are joined by Steve Bland, CEO of WeGo Public Transit. He will be giving his response to a variety of questions on how the era of COVID has affected WeGo Public Transit in ways that maybe we haven't even thought of yet. Many of you have submitted questions already, and we do thank you for that. For those of you who have questions that come up along the way, please use the Q&A icon on your screen, and we will do our best to get through all of the questions. We have 1 hour with Steve, and so you know, this webinar will be recorded and a link sent to your inbox for your reference afterward. With that, again, I thank you for joining us, and it's time to get rolling. So, Steve, can you please give us a little bit of information about you and WeGo Public Transit?
Sure, Jessica, and thank you to the Transit Alliance for giving us the opportunity to be on today. As Jessica mentioned, I apologize for not having my face up, although those of you who have seen my face know that there's not much apology required. I'm bringing the mullet back since haircut services aren't really in our repertoire right now. But I'm Steve Bland. I've been CEO for WeGo Public Transit since August of 2014. And I suspect most Alliance members are familiar, but WeGo Public Transit is the marketing name for really two agencies, the Metropolitan Transit Authority of Nashville and Davidson County, which provides the urban transit services for the city of Nashville, and also the Regional Transportation Authority of Middle Tennessee, which serves the 10-county area surrounding and including Davidson County. And the RTA provides predominantly commuter-oriented services via commuter bus and also the WeGo Star commuter rail line that runs between Lebanon and Nashville. So that's a quick synopsis of who I am and what we do.
Great. Let's see. What you've given us those two. How has COVID-19 affected WeGo Public Transit?
Well, the quickest answer is intensely, quickly, and it evolves on a day-to-day basis. Really, I would say beginning in February, when internationally it started to appear that the pandemic was becoming, frankly, an extremely serious matter for public health representatives and what have you, we were very fortunate to form an early and continues to be a day-to-day productive relationship with Metro Nashville Department of Public Health, and had a number of meetings with them to talk about the implications of the pandemic on public services in general and public transportation specifically. So through that relationship, which continues today and probably for the foreseeable future on a daily basis, public health is able to advise us on the ways that the virus is transmitted. They essentially audited with both our leadership staff and also our union, our cleaning and disinfecting practices, made recommendations on how we could enhance those. And they've been a tremendous resource really day to day on really all of our operating practices. Operating practices were revised really from before Mayor Cooper's Safer at Home order going into effect. And they include things like enhanced cleaning and disinfecting processes, particularly focusing on our high touch surfaces on our vehicles and on our facilities. redeployment of staff, education and training of our employees and our operators on means by which the virus is transmitted, and proper, frankly, as the CDC guidelines have continued to evolve, proper practices, including personal protective equipment. So that's been a large part of our focus. Another area of focus, and really have to give a shout out to Amalgamated Transit Union, Local 1235, for their partnership, was very rapid response in how we redeployed our services. One of the things we did early on, once the Safer at Home order went into effect, was to redeploy services, to pull service away from our very low patronage or kind of our niche routes, be able to put more service onto our heavy ridership routes, while still affording our employees the maximum opportunity to minimize their exposure to the virus. So through this, two of the things we were able to do was take some of our higher risk employees, people who by virtue of age or maybe prior health condition, and we're able to give them extended paid sick leave, the opportunity to take that. And for our remaining bus operators, move them over to a 4-day work week, again, to limit exposure. Among some of the specific protocols we've been putting in place, at WeGo Central, where on a typical day pre-COVID, we'd have about 17,000 people going through. You know, obviously our traffic is way reduced from that level. But for instance, we've closed the public restrooms and the waiting rooms to discourage both mass gatherings and also to allow us to redeploy our custodial staffs to cleaning and disinfecting high traffic areas. Back when our buses come into Central between trips, one of the things our custodial staff do is go on board and disinfect some of those high-touch surfaces. We're continuing to add to our cleaning and custodial staff. And Jess, I think we'll be getting into some discussion on the CARES Act, Federal CARES Act later in the conversation, but that's one of the things that the CARES Act funding has allowed us to do. We literally modify operating practices on just about a day-to-day basis as new information comes to light. We've expanded the availability of our personal protective equipment, including masks and gloves, to our employees. For many of our office staff who are able to work remotely, we've established those remote work environments, as many employers have. And again, altered service schedules to reflect reduced demand on some services, but also, frankly, the need to maximize social distancing on other routes. We're also testing, and we're going to be expanding, again, thanks to the availability of the CARES Act, protective barriers on our buses for our operators' compartments. So I guess the common or the fond term for them is sneeze guards that you see in many grocery stores and retail establishments. And also installing sanitizing stations around WeGo Central and our other facilities to encourage people to sanitize their hands whenever possible. And also, again, repeating the theme of our partnership with Metro Public Health is installing onboard signage and signage throughout our system, encouraging our riders to practice safe hygienic practices. One of the key things we've also implemented, with the reduced number of routes and level of service running, is we refer to them as 99 buses. They're essentially helper buses that we station around the system. So when an operator sees that their bus is getting closer to capacity, they're able to do a kind of a canned message to dispatch to ask for that helper bus to be dispatched along the route. So we've been making increasing use of those 99 buses as we've seen ridership start ticking back up. And I guess the thing that I would highlight for anyone on the call today, or for the public in general, is, originally when Mayor Cooper enacted his Safer at Home order, WeGo Public Transit in general, was recognized as one of the essential services of the city that had to stay running. And I think we're proving that day in and day out, that despite the heavily reduced economic activity and level of travel within the region, on any given day, we have anywhere from 10 to 13,000 people using the WeGo Public Transit system in Nashville.
That's a lot. Thank you for sharing that. You did touch a little bit on funding. So let's go ahead and talk about the CARES Act funding. That's already been a question that's been submitted anyway.
Sure. The CARES Act was a very broad, for lack of a better word, economic development package passed by the federal government. Overall, it was a $2 trillion funding package that was passed back in March and signed into law by President Trump. Specific to the public transit industry, it provided overall nationwide about $25 billion in funding. And the stated purpose was for transit agencies to be able to prepare for and respond to the COVID-19 pandemic. And I would tell you, in a lot of years of working in this industry, both the breadth and the flexibility and the size of the package is really unprecedented at the federal level. I'd start to emphasize this is one-time money. This is not something that's going to come back time after time. So we have to be judicious in how we apply it. But where typically federal funds can only be used for capital expenditures, capital equipment, capital facilities, this is broad enough to allow us to cover for operations as well as capital. The national region overall received about $75 million. That's split with about $55 million going to the MTA, about $14 million to the RTA, and the remainder going to Franklin Transit and the TMA group down in Williamson County. It sounds like a huge amount of money, it is, but when you start looking at how we've been impacted by COVID, the hope is that it's enough, because again, it is one-time funding. And the way we're programming it, we're estimating that it will cover about $14 to $16 million in operating revenue loss. That's fare revenues that we aren't collecting. That's ancillary income like advertising or parking income at the central garage, concession income that we are not receiving due to the reduced economic activity. It's obviously covering the additional operating expenses we have that are associated with enhanced cleaning and disinfecting, the paid leave that we're offering operators to either quarantine or to preserve their own health, and additional expenses. The bulk of the money, though, is really programmed to reflect the support, for lack of a better word, we're going to have to give Metro Nashville in this time of economic downturn. So about of the $55 million that MTA is receiving, we're programming about $14 million toward lost operating revenue, $7 million toward capital projects that will make us more, for lack of a better word, COVID resilient, pandemic resilient. Things like the operator barriers I mentioned earlier, enhanced cleaning and disinfecting equipment, that type of thing. And then the remainder of that funding is really kind of set aside to provide some relief for Metro due to the downturn in the economy and the decline in things like sales tax and other revenues.
Okay. Yeah, once you put it that way, that 75 million can go pretty quickly, right?
Yeah, our projection is, we expect to, with the mayor's proposed budget for fiscal year 2021, we anticipate, or we're projecting to get fully through the fiscal year without any negative impact on services or fares, customers in general, or employees. But we really are assuming that we're well into the recovery by the time FY 21-22 rolls around, or there may very well be some tough decisions that have to be made.
I do have a question about that because right now you're operating on an amended schedule, right? Because you have had to shuffle or readjust your routes. When you say that you're funded through fiscal year 2021, does that mean on these amended routes or on a full schedule?
It would be able to be on a full schedule. Frankly, when we go back to a full schedule is an open question, because again, right now our focus is on putting service where we have the heaviest demand. So we've been running what I would call a modified Saturday schedule. So we're using our Saturday schedule as our base. There are a few routes that we don't normally operate on Saturdays that are operating, and we're operating more service on some of our heavier use routes, things like the Gallatin Road, the Murfreesboro Road, than we do on Saturdays. Our next phased uptick in service will be on June 1st, where we will be adding more service back and putting quite a few more buses out on the street. But again, the focus will be to deploy those on those heaviest use routes. So the routes that are not operating currently, some of our commuter express routes, some of our low patronage circulators in crosstown will continue to stay out of service as we beef up those, those prime routes so that we're able to maintain the social distancing and reduce overcrowding to the extent that we possibly can. So right now, I can't really predict when we'll be back to, quote, our full service schedule. That would likely coincide with when we see, a much higher level of return to economic activity, and particularly when we see schools and colleges and universities fully back in session.
Oh, great segue. So as schools may open in the fall, how do you see handling their influx on the buses?
I'm sorry, Jess, you were breaking up a little bit there. Could you repeat the question?
Yeah. So if the schools do reopen in the fall, how do you see handling the influx of riders at that point?
Sure. Well, a lot will depend on, frankly, what Metro Nashville schools do with their schedule. We haven't heard yet exactly what their plan is. Frankly, I'm not sure whether they know what their plan is, because again, this is an ever-evolving issue. But for instance, there's the possibility of staggered starts, staggered days. Again, by focusing our service resources on our busiest routes, the intent is to, minimize the opportunities for overcrowding. And again, as we've seen for the last 2 or 3 months, it's going to require the ability for us and for schools to be kind of nimble in how we address those issues.
Yeah, I think we're all trying to remain as nimble as possible. Change is constant. So we have a question here. Some drivers have riders that enter on the front of the bus and some in the back. This person is wondering, are there plans to get riders to enter primarily on the back of the bus? Or what other, I guess, procedures are there to help protect the safety of the bus operators?
Sure. It's a great question. And in fact, when all of this started up, there was, first of all, this backdrop. The transit industry is a relatively small industry, but a pretty close industry. So we actually participate about twice a week in calls with our peers from around the country to see what other experiences people are having. And at the outset of the pandemic, the thought was for bus operations, well, gee, let's suspend fare collection and board everybody from the rear door. And that minimizes the exposure of our operators and customers to overcrowding, what have you. And as with everything else, well-intended objectives have unintended consequences. And one of the reasons we've adopted an approach, both in terms of collecting fares and rear door boarding of operator discretion with guidance, is some of the negative repercussions that happen. For instance, I heard from several of my peers who started by saying we're not collecting fares. They said instantly ridership went up 25% because it was sort of induced demand. It's, the basic law of microeconomics. The cheaper it is, the more it'll be used. So they actually went back to charging fares to discourage that unnecessary or discretionary ridership. So essentially, the guidance we give our operators on fare collection is collect if you can, but if you see folks bunching up, if you see a large group congregating, just wave them on through, don't hold that. And rear door boarding is another interesting phenomenon. There's 2 points with respect to rear door boarding. Number one is many of our customers have mobility limitations that require them to use either the ramp or the kneeler on the bus, and that facility is only available at the front door. So one of the risks, and again, I heard this from peers in the industry, when they went to all rear door boarding, they got a number of complaints out of the disability community that they were just being passed by because they weren't able to board at the front door. So again, we moved toward driver discretion. The other is, unfortunately, we don't have the most robust pedestrian network in Nashville. So at many of our stops, um, rear door boarding, frankly, isn't a particularly safe option. You might be climbing through a ditch or, up over a curb, and that presents other safety hazards that we think are untenable. So that's why we've essentially, given some guidance and some background to our operators and asked that they use their judgment and discretion. Does that mean it works well 100% of the time? No. But I think, frankly, giving out a blanket, this is what you will always do in every situation, puts us and our riders at more risk, than our current practice. So, but it's something we keep monitoring, and when somebody finds the magic answer, we're going to be happy to adopt it.
And you
Long
mentioned
answer
that,
to a very simple question, Jess.
but we're here for that. So you mentioned at the beginning, the 99 buses, I think is what you called them. Now, is this a situation where a 99 bus could help in terms of, okay, so there's a lot of people wanting to board at one time that would effectively fill a bus. And if we're trying to practice safe social distancing, a full bus may not meet those measures. You have 6 feet apart. So buses that have that kind of high ridership, is that where the 99 buses are deployed to help catch that?
Yeah, so we run into 2 situations where they're deployed. One is when we know of, and it could be by day of week or time of day, that at this time of day or this day of week on this particular route, we know we always have a crowding situation. So they would be what I would call a regular deployment. And then every now and then you just pop up with a surprise trip that for whatever reason, that particular trip is crowded. And again, as the operating instruction that our operators have is, when you're getting to that point where you're getting, let's say you're inbound on a number 7 bus, and you're kind of getting to a point where it's a little bit crowded, and I know I'm coming up on the Vanderbilt campus and I'm likely to pick up more, that there's a canned message that goes through to dispatch, say I'm approaching my comfortable load of passengers, and it asks to dispatch a 99. Now, that can't necessarily be done instantly. And I'll be honest and say one of the things we've had is an uptick in complaints on what we call pass-ups, which is a bus just kind of blowing by me at the stop. And most of the uptick that we've detected have been those cases where the driver communicated the need for a 99, and the instruction is just run your route, closed door, and then we will restore that service. So unfortunately, it's difficult to get that message out. So what we found was, well, initially, why don't you pull over and explain to people that they can't board and additional buses are coming? But I think we can all predict the reality of that. When you open the door, nobody's going to wait for the explanation. They're just going to hop on the bus. So now what we're doing, we've started to do in the past few days, is actually programming that in when the message goes out, to incorporate it in the destination sign that, essentially the bus is approaching capacity. There's a helper bus on the way. And again, I think the more experience we get on what regular ridership patterns, and we've been very fortunate, our riders have been very patient, and very appreciative of the service, but the more experience we get with it, the smoother it'll go, and folks will get a little bit more used to it. But it also points to, and it's one of the things that, we sort of find refreshing, that this whole experience has really validated what we put forward in the N-Motion plan. And frankly, the approach we took to our service reductions last year, of saying what we really need to do is continue to beef up and improve those core routes that carry over 70% of our ridership, and then work on the ancillary services that support them, because that's where we're seeing, our ridership right now is on those 8 or so core routes. So it's a work in progress, and we're always, anxious to continue to make improvements.
Okay. Let's see. Good to see that here, that you're making constant improvements. Trying to read through the questions. There's been many that have already been answered. Let's see. How do you see these current changes, or do you see them affecting the long-term or the return to business as usual, right?
Sure. First of all, if anyone out there can define what business as usual is going to be, I would love.
Well, I'm looking at permanent. Do you see any permanent changes coming out of this in terms of? Yeah.
So for sure, a lot of what we've learned and a lot of what we're evolving in cleaning and disinfecting practices. And I mentioned earlier, we're programming capital funds to upgrade our equipment to support that, really to state-of-the-art practices. They were showing me one of the things we're looking at. I refer to it as the Ghostbusters backpack, you know, where we'll be able to actually fog buses on a nightly basis, you know, with disinfectant to support those. So some of those operating practices, I think, are the new normal. And, you know, frankly, it'll be reflected in our budget. We're going to have to spend more on things like cleaning and disinfecting, you know, than we have historically. I think some of the things, again, I'm really kind of, I guess I feel as though we were right in the InMotion process, saying that a lot of the projects we focused on in InMotion will make a much more resilient and much more effective transit system in the future. So things like focusing on those frequent transit corridors where we have very frequent service and we can very quickly adapt to changing passenger loads, minimize the opportunities for overcrowding, working with transportation networking companies and other similar applications on our first mile, last mile connection. Our new fare collection system that's in the process of being installed is essentially a touchless system. In fact, the social distancing has kind of delayed our rollout of beta testing among customers for the new quick ticket card and our mobile payment app, but we do have a number of employees, including myself, testing it. And I know when I was using my card on the card reader on the bus and the operator was asking me about my using it, one of the immediate responses he had was, "That's great. They're not getting as close to me, you know, in paying that fare." So again, I think it promotes the idea of, you know, reducing the high touch surfaces on our equipment. The idea of moving to a network of neighborhood transit centers. So we reduce the, what I'll call the over-reliance and the crowding conditions at WeGo Central, and people have more opportunities, you know, to travel in different ways through the community. So a lot of the things that we really had, you know, kind of on the, for lack of a better word, the wish list. I mentioned earlier the challenges with rear door boarding because of the pedestrian infrastructure. So continuing to work with the city to upgrade that infrastructure. And in fact, last week we began the actual construction on our Nolensville Road stop upgrade project, where we'll improve 18 stops in the Nolensville corridor over the next few months. We're quickly advancing both the Hillsborough, the Green Hills Hillsborough Transit Center, and also the North Nashville Transit Center. So I think there's a lot of things that we had, you know, through the InMotion plan and beyond that, you know, were really good ideas before the pandemic that really kind of hold up to everything that we see coming out of this.
Okay. It's good to know that you were right all along. Am I right?
Well, I guess we'll see. But
yeah.
But as a recheck, we're like, yeah, no need to fundamentally change quite a bit of that.
Well, that's good. So tell me a little bit more about the status of your Better Bus plan now and where that's at.
Sure. Well, as a reminder to folks, Better Bus was presented as, you know, a means of improving our bus network, the focus being on our bus network and not what I would call the high dollar capital projects. And that focused on, again, coming back to a recurring theme here, a lot of our highest usage services, those 8 routes that carry over 70% of our ridership. What we had hoped would be the initial phase was extending service hours on those routes, beefing up frequency on those routes, and then supplementing that with improved frequency and span on many of our other routes, creating new crosstowns, creating the mobility on demand services that would feed kind of a first mile, last mile option. So Better Bus remains very much at the forefront of what we would like to do. Obviously, with the economic uncertainty and Metro's current budget conditions, we're not really in a position to expand services right now, particularly with as many unknowns and frankly as many what I'll call non-service related expenses that we're immediately faced with. But as we start redeploying service beginning with June 1st, the fact that we will be pumping a lot more service into those key corridors, those heavily traveled corridors, feeds into Better Bus. So I think for advocates, certainly over the next year, it bears watching on how we can leverage, the outcomes we're seeing through the pandemic into kind of kickstarting that the Better Bus program, once we're in the financial ability to do so.
Yeah, and can you give a little bit of more airtime on what advocates could be doing to help support WeGo through this time and in the future?
Sure, appreciate that question. First of all, as riders, being good citizens as riders right now, and we continue to encourage, as I know the mayor and all of our health officials do, please travel only when it's an essential or necessary trip, and there are a lot of those going on. I've been on our buses, Jess, and I don't see a whole lot of joyriding going on. It's people who are very obviously going for life necessity trips. When you ride, you could use good social distancing practices. Wear your face mask, do all of those things. So it starts by kind of practicing what we all preach, as we try to go through this. Number two, obviously staying informed, and anybody who is participating in this webinar is obviously following through on that as to what's going on, and frankly, what is and isn't real. There's the opportunity in the current condition to say, whoa, $75 million from the federal government, that's a windfall, and what all are you doing? And then there's the equally dangerous opportunity saying, whoa, a $22 million funding cut from Metro and the sky is falling and, everything is really negative and nasty, but just kind of staying informed and then letting community leadership know, elected officials, business leadership, civic leadership, media representatives, and the Alliance does a tremendous job of this, of keeping folks informed, really of the value of the public transportation system as part of a broader mobility network and the need over time to have it adequately funded. And ideally over time to have it funded in a dedicated manner so that we're not putting the mayor and the council in that unenviable position of having to try to choose between schools, police, and public transit.
Those are some really good tips, and I appreciate that. I know Transit Alliance is one of the advocacy organizations supporting transit right now, but we're certainly not the only ones out there, and some folks from those other organizations are on this call, and I'm really glad that we're all getting a chance to hear that. There still seems to be several questions in terms of preparing for an uptick in ridership, even though you've already said there has been a small uptick in ridership to date. What could you tell us a little more about what the plans are for handling that uptick in ridership as it becomes necessary as we reopen the region? And could you talk a little bit, maybe precede that answer with,
I'm sorry, Jess, you really, you broke up on that one on me.
I'm sorry, my internet is unstable. But how do you see transit supporting our regional reopen, economic reopen? And then how will you handle the uptick in ridership?
Sure. Well, first of all, I think the primary thing we could do as more and more of the economy starts to reopen is on a larger scale, do what we're doing now. I can't tell you, I've been working in this industry for more years than I care to admit. Although I guess if my face were showing and you could see the gray, you'd know that it was more years than most people would care to admit. And I've never been prouder of a group of people than I have of our employees through this. Despite the challenges of coming to work and operating a bus every day in these ever-changing conditions, we've actually seen our rate of absenteeism, unscheduled absenteeism of our operators go down relative to what it had been. So the folks who work here are very mission-centric. They know how critical they are to the people they carry, and they know that the value of the trips those folks are taking. They are the people who are cleaning our hospitals and serving our meals and, you know, doing those types of things. So sustaining that level of reliability, maintaining those relationships with folks like Metro Nashville Department of Public Health, to know what really the state of the practice is on trying to keep people as safe as possible in this environment. And then building our service back in a way that is most responsive to the needs of the community. And with respect to that last point, I'll give you some information that some folks may interpret as bad news, some folks may interpret as good news. So overall, what we've seen with the WeGo system, MTA and RTA, is total ridership has been down about 70% on average. But if you look within that, there are real splits in that. You know, are what I would call hardcore commuter-oriented service, where you tend to have office workers, you know, coming to downtown jobs, where frankly, a lot more people have been afforded the opportunity to do remote work arrangements. So we see on our RTA commuter bus service, for example, ridership's down about 93%. On the WeGo Star, ridership is down about 92%. But on the MTA bus system, it's only down about 60%. And on some of our routes, it's only down by 30 or 40%. So as we are able to restore more service and deploy those resources, again, with a relatively fixed upper number, you know, the idea that we need to put more buses into those core routes where we see highest levels of ridership now, but in all likelihood, the highest levels of ridership increase coming back for the foreseeable future, and holding off on reinstating some of those other services like commuter express services that just aren't carrying anyone in the short term. I think we have to recognize that's a short-term reality. And talking to a lot of business folks I know, you know, who are in office environments, the idea that, hey, I'll let my folks work from home as long as, you know, they don't feel, or they feel more comfortable doing so. So it's probably going to be a long while before some of those markets return. You know, on the other hand, as the service, this is a service sector economy in large part. And as those service businesses, those restaurants, those bars, you know, the other facilities, the retail establishments come back online, we know that that's going to be a significant amount of our ridership demand. As schools reopen, you know, during a normal part of a school year, student ridership, college and university, makes up about 15% of our ridership. You know, so deploying services into those key heavy usage corridors, you know, is going to be critically important. And that's where a lot of our focus is right now and for the foreseeable future.
Okay. I know that COVID-19 is taking up a very large part of all of our collective brains right now, but are there other trends or issues that WeGo is facing beyond COVID?
Well, there are, but I think I'll turn it to a kind of a positive note. If there's a bright side to all this, anybody who's in the construction business will tell you this is the perfect time to be doing construction. You know, when we don't have a whole lot of traffic going on out there. So I mentioned a couple of projects earlier that are moving along, you know, very well and very quickly now. Our fare collection project is moving right along. And again, other than the fact that we're sort of pushed back by really not being able to communicate as well with folks to start our customer-based beta testing, you know, the installation of equipment and the debugging of software and our integration with Metro Nashville IT and payment systems is going along very well. So, you know, once we get to some later stages of reinstating the economy, that beta test with customers is going to be one of the upfront things. And when you talk about advocates and how they can be involved, you know, let us know if you'd like to be involved in the beta test for the mobile apps and the contactless smart cards and that type of thing. I mentioned the Nolensville project. We've been collaborating very closely with TDOT, Metro Nashville Public Works, on that project, which will have the impact of closing lanes on Nolensville Pike at various stages during the project. And the message from them is we want to help you get it done as quickly as possible while the traffic, you know, while the traffic counts are lower. So we've actually been working with our contractor to accelerate that schedule and certainly hope to have it done in before this time next year. Similarly, we're expanding the capacity of the Mount Juliet Park and Ride. That was an oversubscribed park and ride lot. And the fact that we have very few people parking there now is a great opportunity for our contractor, who is, working like crazy to do site clearance and demolition, and all sorts of work on site to move that project along. We're working in concert with Metro Nashville Public Schools on the Green Hills Hillsborough Transit Center project. And with schools closed, they've been able to actually advance the Hillsborough High School renovation project very quickly, which means we've actually had to accelerate the transit center project. So we're looking to partner with the school district to actually use their contractor to do a lot of our site work and our utility work. And we expect that work to be commencing this summer. And all indications are the new transit center will be online for the start of the school year in August of 2021. So a year from this coming start of school year. And I mentioned our advancing work with the North Nashville project. We're very well along in the lease negotiations with that property owner and have started doing things like surveying and geotechnical investigation of the site so we can kick off hardcore design. So there are a lot of things, independent of the pandemic that had been, longstanding parts of the NMotion strategic service plan that we're really seeing, things are finally, the rubber's finally hitting the road on a lot of these projects.
Those are all very promising projects, and I'm glad to hear that. So we have a question. What are the routes that are only down 30 to 40%? Do you know which routes those are?
Yeah, and actually an interesting one, I'm happy to send it along for you to distribute however you see fit to members of the Alliance. But our planning staff actually did, so we're starting to get used to the heat maps from public health. We actually did a heat map of our route network to show various routes that are, and frankly, where their ridership is. So a lot of the routes are the ones that you would expect that are down, now every route in our system is down. There's no route in our system that's carrying as many riders as it did before all this started. But the ones that are down the least are routes like the 56 Gallatin, the 55 Murfreesboro, the 22 Bordeaux, the 23 Dickerson, the 7 Hillsborough. So, those are all routes that are performing better than average. Some of the routes, now we've taken some routes out of service, so they aren't fair comparisons. So some of those commuter express routes like 35 and the 38 essentially aren't carrying anyone. And then other routes that are operating that are losing more ridership would be, again, it'll be interesting to see what happens as retail reopens. But for instance, with the Opryland complex and Opry Mills substantially closed, our number 34 has certainly been one that is that's plummeted in ridership. But we can absolutely, in fact, Jess, I'll forward you a copy of the heat map as soon as we're done here.
That'd be great. I've already had a couple of folks say they really want to see that. Yeah. So a couple of more questions as we wrap up. We're in the last 15 minutes. Are there any updates on the bus operators who tested positive for COVID-19?
Sure. First thing I would let you know that really nobody, and again, we are in communication with Metro Nashville Public Health on a daily basis. None of the riders were ever at risk. In fact, one of the operators is fully recovered, so they had the illness, they fully recovered. But they actually didn't show symptoms until 4 days after they had last worked. And then once they were tested, we have a protocol with our union, in terms of how we quarantine, how we pay folks on administrative leave when there's any risk. And then the other operator has not shown any symptoms yet. They frankly were tested as a result of a spouse who received a positive test, tested positive, but never showed symptoms. And they are still in the midst of that quarantining period, but still haven't shown any symptoms. So, at no time, we've had a great cooperative relationship with Metro Nashville Public Health, and they're doing a great job doing a lot of the tracking. So, if there were an instance where folks had been at risk, through a combination of the information they're able to provide us, our onboard video systems, what have you. We have a great mechanism for trying to, alert folks, and literally no one from the public had ever been at risk in either of those cases.
Good. Thank you for that update. So we talked a little bit about your Better Bus plan. Given the current circumstance, current situation in terms of funding and COVID-19, are there plans to develop a new transit proposal, or are we sticking with Better Bus?
Well, Better Bus from a service design standpoint, again, from our perspective, has certainly shown the resilience of the pandemic, and similar to N-Motion, the core tenets of the Better Bus program really kind of show through in the pandemic. We are actively participating with the mayor's office on their broader transportation and mobility plan. I talk to Faye DeMassimo in the mayor's office probably at least 2 or 3 times a week. And certainly we're anxious to see what comes out with the full breadth of that plan. But in terms of, fundamentally realtering, we haven't seen anything. Would it be tweaked depending on how certain things shake out? Sure, probably so. Might things be reordered, in terms of when they roll out based on when money is available? Yeah, probably so. But the core underpinnings of the plan, I think, have proven to be very, very valid through the course of the pandemic. And again, when you look at those heat maps, reinforcing the fact that the core routes we operate now, the carrier that will always be, at least for the foreseeable future, pandemic or no pandemic, the backbone of the system. And the more we can do to reinforce and improve services in those corridors. And when I say that, I mean extending service hours, make it more frequent, improve connections, create better pedestrian connections to those locations, work on first mile, last mile connect, all the things associated with it, the stronger the system will be, and the more resilient it will be, not just against things like COVID-19 or potential other health risks, but also other things that might come down the line. So there's validation that we'll tweak as we go along, and we revisit, what a lot of these issues are, as many of the unknowns become more known. For us right now, probably the biggest question is how long will it take for what I will call the true downtown commuter to come back? And that's sort of a big open question. And frankly, it's a bigger question on the RTA side than it is on the MTA side.
Yeah. I had that question, but then you answered it in a different answer. How worried were you about the RTA routes as opposed to the MTA routes? Seems like they're down a lot more than the local connectors here.
Yeah, absolutely true. And in large part, when you look at the ridership core on the RTA, it does amount to, what's the future of office employment. Now, in talking to folks, in that industry, yeah, there's going to be some, and with the growth we've had overall in jobs in Nashville, we absolutely expect it to come back. It's a question of how long will it take. It's one of the reasons with respect to the CARES Act money that frankly we have programmed to try to carry the RTA longer with that funding through CARES Act support to replace operating revenue. Then we have the MTA. We actually expect MTA overall ridership. Now with respect to, downtown work-oriented commuters, there's not a lot of difference. But because it makes up a smaller percentage of the MTA base, we expect that operating revenue to come back a little bit more quickly, than on the RTA side.
Speaking of the funding, do you expect the mayor and council to replace the $22 million in the next budget cycle?
Well, I will tell you what I know, and to a large extent, none of us, including the mayor or council, will know all of this, is certainly with the reduction in transit funding in this year's Metro operating budget, it does not reflect a change in the priority of transit in the eyes of the city, the eyes of the mayor's administration. It frankly reflects the reality of a significant budget challenge for Metro, and frankly, the fact that public transit, and WeGo specifically, are in much better shape to use federal CARES Act funding to replace those funds. So it's not something that the police department has access to. It's not something that Metro Schools has access to. And in all of our conversations with the administration, there is the intent to replace that funding in next year's budget. But of course, none of us know how quickly the economy is going to return, or what those. So it's something that I think bears watching for transit advocates and other advocates, education advocates, affordable housing advocates, to see how quickly the economy comes back, how quickly Metro's, overall operating position improves, and what position the mayor. I don't envy them those choices. They're tough choices, because there are frankly no bad. There's not a whole lot of low-hanging fruit, for them to pull from. So it bears watching, but certainly there's no indication that this budget was any reflection of a fundamental change in priorities.
For sharing that. Two more questions that I see here. Is WeGo asking riders to make notes about their schedule, the route they're on, and bus ID to assist in potential contact tracing at all?
Well, we would always ask folks, and particularly it comes up, like I've had some folks contact me and say, hey, we saw an operator that wasn't wearing a mask, or doing this or that, or not following what our protocols would have been. So whenever we get those inquiries, we always request the better the information you have about time, location, bus number, what have you, the easier it is for us to trace back, what that situation is. And we can do things like, interview involved operators. We can review audio and video from those particular trips to do a more complete investigation. So generally speaking, I think it's a good idea. I don't need for people to be anal about it. And frankly, even as long as you can say, well, I was on this route at this time, and most people know, yeah, I usually get on the Route 7 at 4:30 or whatever it might be. We can generally track it back to a bus. But again, as we're sort of changing our practices, I think the health department would probably tell you, yeah, the more information you have about who where you were and what contacts you made, probably the better off you are in trying to determine whether you're in an at-risk situation or not. Again, what we found here is through the contact tracing, we really haven't been contacted by health about folks who were exposed in that manner via public transit. So, so we're really encouraged by that if people, follow the proper protocols, keep your hands clean, don't touch your face, wear a face mask, only travel when necessary, try to maintain social distancing. And I can tell you, I've ridden the bus quite a bit over the last couple of months, and I certainly don't feel unsafe in doing so.
So one question we have is about the mayor's transportation plan. You recall that there was a series of 11 community meetings earlier this year. We understand that it's been delayed from the original big reveal that was supposed to happen in June. Do you have any idea about a revised timeline at all?
Well, I mentioned earlier, we talked to Faye pretty frequently, as recently as yesterday. I haven't talked to her yet today, although that probably will happen. It's early yet. And I think, again, kind of like what I was saying earlier with our quick ticket and trying to do beta testing on fare collection, in large part what they're looking to is they're going to want to have another round of public engagement to, roll out the plan and get reaction to it so they can make some modifications. So I think it's really kind of reliant on two things. It's reliant on, first of all, the city getting through the budget process, because the council will be heavily involved, in the rollout of that plan. And number two, getting to a point where either we can do public meetings again, or people are pretty confident that this form of communication is as inclusive as it can be. And I will tell you, I've been very appreciative of things like WebEx and Microsoft Teams and conference calls, but it's difficult. I think we would all acknowledge, this would be a much different forum if we were all, gathered over lunch somewhere, and able to have those exchanges. So, and I don't want to speak for Faye or for the mayor's office, but I know they are working very hard on it, and they continue to develop more material. So I think it really just kind of, when will we be able to get back where it can be more of a central point in the attention span of the public is probably the best answer I could give.
That's great. We are down to the last 5 minutes with Steve Bland. I want to ask you, Steve, are there any other words of wisdom that you would like to share with us before we close out for the day?
I suspect if I give you words of wisdom now, they would be the first that I've given you in the hour. But I would just kind of repeat some of the sayings we've all been reiterating over and over. We're in this together. I think we'll all emerge from this different, but in some ways enhanced. Hang in there. Keep as an advocate. Keep informed. And keep informing those that you know of what needs to be done. Continue to obviously participate with the Transit Alliance and the other advocates out there. They are great sources of information. And I've always been very open about giving out my email and my contact information. So if anyone has any direct follow-up questions, don't hesitate to contact me. As I tell our staff, sometimes it takes me too long to respond to an email. But eventually I do get to it, as the box gets cleared out. So hang in there, and there are good things coming, in many ways. Within 6 months or a year, there'll be a lot of new things coming online for public transportation in Middle Tennessee that I think are pretty exciting.
Excellent. And one more thing, if you had mentioned beta testing, who do we let know at WeGo that we're interested in participating in the beta testing?
Well, I wish I knew that off the top of my head, Jess, but when I send you the heat maps,
okay, good,
ridership, I will send you the direct contact. We are accumulating, and we have a list of quite a few folks who've expressed an interest. So I will send you that information out, and if you could distribute it to the folks who participated today, we'd appreciate it.
Perfect. And I have some thoughts from a rider who's currently riding the bus, and her name is Christine, and she's on the webinar, and she says she does worry about the planned suppression of some of the bus stops, although agrees with the passing by with full buses. And she also wants to thank you for the new shelters on the 7.
Oh, awesome. I didn't get to that. One of the projects that we're actively involved in is our stop and shelter crews have, in addition to what we're doing on Nolansville, which is being done by a third-party contractor, we're in the process of replacing 23 shelters total. Unfortunately, some of those are the result of both. So with traffic being down, the downside is cars are going faster, and when they hit our shelters, they tend to do more damage. So a few of those are shelters that were hit. One was unfortunately our Main Street shelter station on the 56 in East Nashville that was taken out by the tornado. But we're replacing a number of our old shelters that were in need of replacement, and reflecting our hopefully soon to be implemented spring service changes, moving some shelters around. So again, one of our top priorities, it's a better bus priority, was an in-motion priority, is improving the quality of stops and shelters throughout the system.
Thank you so much, Steve. It's been a wonderful hour. I know I'm coming out of it with new information. I hope our listeners have found it valuable. If you have found this valuable, please go ahead and register for our upcoming speaker series. There are 3 more left. Friday, we'll be chatting with Michelle Lacewell from the Greater Nashville Regional Council. And next week, we talk to 2 national leaders about trends that they're seeing on a national level in terms of funding and also just on the ground transit, as we've discussed here with Steve today. Also, we've pivoted our Transit Citizen Leadership Academy to an online platform beginning June 15th. You can go to www.thetransitalliance.org and find out more about both the speaker series and the TCLA there, and register for both of those things. As we depart, I want to thank you again, Steve, for sharing your time with us. It's a lot of information that we've gone over. I can't thank you enough for always coming back and sharing what you can with our members, and to you folks who in the community who have logged in and have been supporting us for a while. Really appreciate that. And to our sponsors who make it possible for us to provide these kinds of programs for free. And I can't wait to see you all again. Thanks so much.
Thank you, Jess.
Mhm.